Hello, this is Fred Goldstein at Think 360, the Healthcare Innovation Congress in Baltimore, Maryland. It's the afternoon of the third day, and I'm joined by Tom Policelli, the CEO of PayMedix. So welcome.
Thank you. Glad to be here.
Tell us a little bit about, your background, and then what is PayMedix?
Sure. Well, I'm a health insurance guy. That's how I started off. And I was really big on consumer engagement. And to me, that took me down the path of what we now call consumer-directed healthcare. This high deductibles, get consumers engaged. Problem was, it didn't really work out that way. And that's really where PayMedix comes in. Reason why the high deductibles didn't work out is because people just end up being confused. They're getting hit by bills and EOBs and statements and things that don't make sense. And so they just disengage. And they don't pay attention to anything we send them. And some of it is actually important. And that's what PayMedix does. PayMedix comes in and strips away all of the complicated financial statements and EOBs and all of that, summarizes simply everything for the consumer, and then we pay the provider on behalf of the consumer, all of the consumers, regardless of individual credit rating or anything. We take care of it all, and we simplify the entire system.
And then does the individual then pay you?
Correct.
For the service?
They do. And here's the interesting thing. Two things. One, consumers of all income levels in the commercial market, the number one issue they have with higher deductibles is not money. It's not financial. It's confusion. They just have no idea what to make of all this. Once we get rid of all that confusion, which we do, then comes the money part. And they're so grateful for having cleaned up this confusing mess that our Net Promoter Score, how much consumers like you, is a 75. Wow. Health insurance companies are in the 20s.
Right.
People have to pay us money and they really like us because we just made it simple.
Uh-huh. And so is your client the employer, the provider, who is?
And the consumer.
And
we're an intermediary.
Okay.
So we sit in between. And the reason why this is important is because we use the word all a lot. We solve all of the problem for all of the consumers, for all of the provider dollars. There's so many point solutions in healthcare right now, and each of them are trying to optimize a little part. But when they each try to optimize a little part, they're actually creating more complexity for the system and cost, and therefore confusion. So we do it all. And so we sit in the middle between the provider, and we pull consumers in through their employers, and then we sit in the middle and just handle all of it. And therefore we can make it simple and affordable. Mm-hmm.
So is it the employer that contracts with you to provide your service for their employees?
So the employers do, but really the real economic lever is for the providers. Providers right now are spending a fortune to irritate consumers and get paid very little. And so we step in and we have a fee the providers pay that really covers the bulk of the economics.
Oh, wow. And then are you operating throughout the country, or?
Yes, we started up in Wisconsin. We've been doing this for years. We've put $5 billion through this machine. Like I said, we have a great Net Promoter Score, so we've got a great base, and now we're building out across the country. Mm-hmm.
And yeah, given with that Net Promoter Score that high in the 70s, obviously the consumers like it. Mm-hmm. So do they even know, in other words, if the provider is working with you, mm-hmm. then they get something, instead of a bill, they get something from you to say, here's what your payments are that you've got to make for this provider?
That's right. We send out to the consumer a simple monthly statement, and it's online too, of course, that it's analogous to a credit card statement, which we're all sadly used to what a credit card statement is, but it summarizes, here's everything that happened. And you really do owe $212.14. We're so sure of that we already paid the provider, and that's it.
And you've already factored in the insurance and everything else because you've seen what the provider got in.
Right, that's really important. We actually come in after insurance, so we don't touch the insurance. So whatever has gone on between the employer and the insurance company and the consumer insurance company, that's all before us.
And then you let them know, now this is your patient portion of responsibility. I'm thinking about some bills I was looking at earlier today, and trying to figure that out. Mm-hmm. So it's really fascinating to watch how that works.
Yeah, and that's, from the provider perspective, there's really 3 steps if you're a provider. Provide care. Don't worry about any of this. Provide care when you see our logo. Send in the bill. Cash the check. That's what you do.
Wow, that's fascinating. Well, thanks so much, Tom, for coming and talking to us.
Thank you. Really appreciate it.
It's really a pleasure. This is Fred Goldstein at Think 360, the Healthcare Innovation Congress in Baltimore, Maryland.